Can shingles vaccine prevent dementia? Can treatment with Varenicline help youth stop vaping? Should clinicians check vitamin D levels? How might certain infectious diseases reemerge in the U.S. under declining childhood vaccination rates? All this and much more on this episode of the JAMA Editor's Summary. Hello and welcome to our listeners around the world. Today is Friday, April 25th, 2025. I'm Dr. Preeti Malani, JAMA Deputy Editor, sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief for JAMA and the JAMA Network. Today I'm joined by JAMA Deputy Editor, Dr. Chris Muth. Hi, Chris. It was another busy week at JAMA. Let's get started.
Okay. Hi, Preeti. First, JAMA published a quasi-experimental study by Dr. Pomerci and colleagues in which they investigated the herpes zoster or shingles vaccine and dementia occurrence. The authors used primary care electronic health record data from 65 practices in Australia to identify individuals' eligibility status for a free shingles vaccine. Then using the EHR, they looked for new diagnoses of dementia for those eligible and ineligible to receive the free vaccine. And they found that being eligible for the herpes zoster vaccine decreased the probability of receiving a new dementia diagnosis by 1.8 percentage points over the next 7 years of follow-up.
JAMA published some great research articles this week featured at the Pediatric Academic Societies meeting, which is underway in Honolulu, Hawaii. There's a research article by Dr. Evans and colleagues about Varenicline for nicotine vaping cessation in youth aged 16 to 25. This was a 3-group randomized clinical trial that compared Varenicline treatment plus counseling and text messaging support, placebo plus counseling and text messaging support, or text messaging support only. The authors conclude that the Varenicline treatment group had increased vaping abstinence compared with placebo and text messaging alone. In a separate study, Dr. Cummings and colleagues looked at pediatric topics in mental health. They used claims data from 22 U.S. states to identify changes in mental health or neurodevelopmental disorders between 2010 and 2019. The percentage of publicly insured children receiving diagnoses in these categories increased from 10.7% in 2010 to 16.5% in 2019.
Yes, and former Director of Medicaid and CHIP Services at CMS, Vicki Wacchino, along with Dr. Richard Frank, contributed an editorial for this article. They discuss possible reasons for these concerning increases and emphasize the importance of public coverage for children.
This next topic is very timely in light of declining childhood vaccination rates and an ongoing measles outbreak in the United States. Dr. Keong and colleagues wrote a research article in which they used simulation modeling to estimate the reemergence of measles, rubella, polio, and diphtheria in the U.S. over the next several years based on various hypothetical rates of childhood vaccination. JAMA also published a preliminary communication research article being presented at the World Congress on Osteoarthritis. Dr. Pan and colleagues randomly assigned participants with symptomatic osteoarthritis and a BMI of 25 or higher to either metformin or placebo. Participants in the metformin group reported a statistically significant reduction in knee pain at 6 months compared with those in the placebo group.
And JAMA published a research letter this week by Dr. Lee and colleagues that investigated non-risk-based lung cancer screening with low-dose CT in China. In over 11,000 participants aged 40 to 74 years, the authors reported that the lung cancer detection rate among high-risk individuals was fairly comparable to individuals classified as not high risk. And interestingly, a higher proportion of stage 1 cancer was detected in the group without high risk.
JAMA published a Viewpoint by Dr. Philippe and Powers recounting the events that helped shape early research surrounding Glucagon-Like peptide-1 medications.
In another Viewpoint, Dr. Zhang and colleagues emphasize the importance of health survey data. The authors highlight how a robust national health survey infrastructure can align with federal government's prioritization of confronting chronic disease.
The editor-in-chief of JAMA and the JAMA Network, Dr. Kirsten Bibbins-Domingo, published a year in review with other JAMA executives. This communicates the exciting changes across JAMA and the JAMA network that happened in 2024, including the transition to publishing all JAMA content online first. All of us at JAMA are looking forward to new opportunities to communicate science and medicine in 2025, including being host to the 10th International Congress on Peer Review and Scientific Publication in September of this year.
The JAMA Rational Clinical Examination article reviews the topic of physical abuse in children. Dr. Shaw and colleagues identify important physical exam and radiology findings that could indicate physical abuse. And Dr. Lindberg and colleagues contributed the accompanying editorial. The editorialists discuss how to interpret the author's Bayesian approach and nuances to consider when applying Bayesian-derived conclusions to high-stakes clinical and legal decision-making.
The JAMA Clinical Review synopsis about vitamin D for disease prevention is authored by Dr. Liu and colleagues. They summarize the Endocrine Society's recently published guideline that focuses on evidence regarding supplemental vitamin D and screening recommendations for children, pregnant patients, older adults, and adults with prediabetes. In a related editorial, Dr. Gilman and colleagues explain some considerations for applying these guidelines to primary care practice. An associated JAMA Clinical Reviews podcast provides additional conversation around this important topic. Let's listen to editorialist Dr. Sherry-Ann Burnett-Bowie discuss key patient communication strategies regarding vitamin D supplements.
I think the main consideration that I would really stress, these guidelines, this update relates to patients who are healthy, and it does not apply to patients who have certain diseases that might impact their vitamin D metabolism, nor does it pertain to patients who have diseases that having vitamin D levels that are quote unquote normal, it would be important for them. So if your patient has advanced kidney disease, if they have malabsorption, if they are at risk for low vitamin D levels because of either their diet, being vegetarian, being lactose intolerant, being breastfed, or if they are on certain medications that might increase the metabolism of vitamin D, those are patients who you should screen with 25-hydroxyvitamin D. If your patient has hypocalcemia, low calcium levels, fragility fractures, or osteoporosis, again, you should be screening them with vitamin D levels and ensuring that they are at least 20 nanograms per ml. And based on other clinical parameters, whether that patient has hyperparathyroidism, by way of example, you might desire a higher 25-hydroxyvitamin D level. But the key thing is that these recommendations are for patients who are healthy, and they are for the prevention of disease.
The JAMA patient page this week is about symptoms, diagnosis, and treatment of atrial fibrillation. And the JAMA Insights article is all about lipoprotein A. Doctors Mora and Cronenberg summarize what this particle is, along with testing and management recommendations. JAMA Med News Director Jenna Bossi also provides a highlight review from the 2025 American College of Cardiology's scientific session. Let's end with a bit of Jenna Bossi's discussion with JAMA Cardiology Associate Editor Dr. Ajay Kirtane from the JAMA Med News podcast.
Really, the key question is that everybody knows that it's healthy and great to run half marathons and marathons, but we also know that there are patients who don't survive those things. And we would like to get a better idea of what's happening with those patients. Why is it happening? And is there a way of preventing it? And have the ways that we've instituted to prevent it had success? And that's exactly what RACER2 did. It was a study looking at more recent participation in half marathons and marathons to see how patients did, what the rate of sudden cardiac events was, and how patients survived after that.
Thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Chris Muth and me, Dr. Preeti Malani. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. And thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.